do go out to the parking lot, or to get into your car, you know how to, and it reduces your anxiety for that as well. Other things that I sort of remember happening in the hospital, my wife remembered everything, so she filled me in later, but the social worker that I met 3 weeks before came into the hospital room just to make sure everything was organized and ready to go. They arranged for a therapist to come into the house. I already got the motion machine delivered, and we also were able to talk with our physician's assistants about what to expect and check in and see what was going on. Well, everything went really well while we were in the hospital. I went from a walker to actually using a cane on the second day after surgery, so I could glue around it. I couldn't get rid of the cane, but Megan told me that was okay. You just have to go with the flow, wait and see. You'll know when it's time. I saw a couple other patients that I met before. They were still using the walker, and Megan said, "That's fine. You just do what you feel comfortable doing. Everyone goes at their own pace. Keep working. You'll know when it's time to do that." So the day of discharge, they walked in and gave me this bag. I said, "What this bag for?" Well, little did I know how much stuff they were going to send home with us. It included the blood thinning medicine, the exercises, who to call, your medicines, all those kind of things. They just sort of stuck it in a bag. They also told my wife that she was welcome to use the valet parking again. So when she came up on the day of discharge, she just valet parked. And then the floor called downstairs when it was time for me to leave, and they called the valet, and the car was delivered to the front entrance so that making the discharge, it was much more easy for both my wife and I to get out of the hospital as well as when we came in. So in going home, I started the process, started the home therapy. I only did it over the weekend. Felt good enough on Monday. I wanted to do the outpatient therapy where, they can really start working you out again. And it was doing all the same things that we started in the hospital. And then the doctor said she likes to see all of her patients about 4 weeks after the surgery. By that time, I was walking without the cane, although I still had achiness. I had heard that knees are more work for patients than hip replacements, and it was true. If they still get achy, I get a restless feeling at night. It's still swollen. But that arthritis pain that I had before was gone. The pain was it was a different kind of pain now than what it was before the surgery. But I was already seeing the improvements. I was able to do steps the normal way, not 2 feet or 1 step. Although going down, I wasn't able to do quite yet. I was going out of the house. I actually went back to work a little bit, part-time, about 2 weeks after surgery. Not quite ready for full-time then, but was getting better and better. And showed up to the doctor's office, very little wait. There was, again, a lot of questions from the doctor's staff to find out what was going on. Got in, got my x-rays, got to see the x-rays, got my marching orders, and I was out of there in an hour. And basically was told, I let the patients can determine how fast they go, because with our new techniques that were used, there's no restrictions anymore in people's activities except what they place on themselves. So everyone, again, goes at their own pace within that. So after that, well, Donna told the story of how it has afterward. What I just told you, that whole story, that's our program. No, it's okay. It's again, this is part of our methodology. We're not perfect by any means, and I don't want to ever give that impression. But I will tell you, we try to be perfect, and we always are looking for ways to do things better. And the biggest source of information to drive that process has been coming from our patients. And that's why I think if you go through the program and see the kind of things, although we're not perfect, we are striving to do a better and better job for everyone. And when you do look at the care experience through the eyes of the patients, in all of our groups that we've started, it's a real eye-opener when you go through. And I think if you have gone through the program at different stages, you will have seen that we are always trying to do something differently and try to make it a better experience, not just a better surgery. And that's our goal in the methodology as well. And remember, the biggest thing, not every person requires surgery, but to me, there's no reason for a patient and their families to have a patient live in pain, because you're the one that's going to decide what the intervention is, whether you want an injection, whether you want to just take medicines, whether you want to lose weight, whether you want surgery. It's really the patients that are the ones that are the drivers in the decision for that. Our roles, as I love Terry Starr's analogy, is we are the navigators to help you sort through all the decisions and all the things. But the ultimate decisions are yours, but you have to be educated and empowered to make those decisions, and that's what our goal is for today. So with that, I'd like to ask if you've been keeping your cards, if you could pass your cards to the aisles, and we'll have some of the people come through and pick them up.